Most everyone at some point in their life has felt the terror of anxiety. Those who have anxiety are said to be ruled by fear. The National Institute of Mental Health says that over 40 million individuals suffer from some type of anxiety in a given year. Anxiety is defined as distress or uneasiness of mind caused by fear or danger or misfortune. But regular anxiety is only temporary for some. Anxiety disorders are much more than temporary worry or fear. For those with anxiety disorders, the fear and worry never go away and can only get worse over time without treatment. According to research by the Mayo Clinic, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes. The term for this is a panic attack. Panic or anxiety can begin to interfere with a person's everyday life. They are hard to control and they can last a long time. There are many types of anxiety disorders. Most have similar physical and mental symptoms. Feelings of being powerless, nervous, weakness, and tiredness, having an intense sense of impending danger, panic, or doom are the most common mental symptoms. The physical symptoms include, but are not limited to, an increased heart rate, rapid breathing or hyperventilation, sweating, trembling or shaking, and being incapable of concentrating, thinking, or doing anything except for worrying about what is currently on their mind. Some of the anxiety disorders include separation anxiety, selective mutism, specific phobias, and agoraphobia. The disorder I would like to discuss is the most common, which is panic disorder. Panic disorder is an anxiety disorder that can sometimes run in families. The symptoms of panic disorder are attacks of fear that come out of nowhere repeatedly, and they have no control, worrying about the next attack. They can have a fear of places where one has had a panic attack before, and physically, one feels their heart race, sweat, hyperventilation, weakness, and dizziness. They can be extremely hot or cold, have chest pain or stomach pain, and it feels almost like a heart attack. These attacks peak at 10 minutes, but the effects can last much longer than that. According to the National Institute of Mental Health, panic disorders affect about 6 million American adults and affects women twice as much as it does men. Those affected by panic disorders can become disabled by their attacks and should get medical attention as soon as possible before the panic starts to help them avoid places and situations where the attacks have occurred before. Some people restrict their lives so much to the extent that they will not go grocery shopping or can even ride in a car. If not treated early enough, you can become agoraphobic. Agoraphobia is defined by the Mayo Clinic as a type of anxiety disorder in which you fear and often avoid places or situations that might cause you panic and make you feel trapped, helpless, or embarrassed. With agoraphobia, some have a hard time feeling safe in public places, especially ones that are crowded. It can become so intense that the person could eventually feel incapable of leaving their own home. There are many treatment options for a panic disorder. Once it has been diagnosed, the most common practices are medicine and psychotherapy. The psychotherapy that is most effective with panic disorders is cognitive behavioral therapy. This type of therapy helps the person use coping mechanisms to deal with their fear and anxiety. This method does take time, so the doctor could usually prescribe medicines. The kinds of medicines that are most effective, according to the Mayo Clinic, are selective serotonin reuptake inhibitors, or SSRIs, serotonin norepinephrine reuptake inhibitors, or SNRIs, and benzodiazepines. The SSRIs have the lowest risk of side effects and are usually the doctor's first choice to treat panic disorders. Benzodiazepines are sedatives to the central nervous system, and it calms the effects of panic disorders. These drugs, unfortunately, can become habit forming and cause dependence upon them, especially if one has to be on them for a long period of time or they're on a high dose. These drugs usually are used on a short-term basis. Some things one can do to help aid the treatment at home, aside from staying on your doctor's treatment plan, is to join a support group, avoid caffeine, alcohol, and drugs because they only exacerbate and trigger panic attacks. Use stress management and relaxation techniques such as yoga or meditation, and become, if not already, physically active and get plenty of sleep. As long as you follow your doctor's orders and try to become stress-free and use coping mechanisms, those who suffer from anxiety no longer need to feel ruled by fear. For those with anxiety, there is help.